The Ultimate Beauty Show is all about being open and honest with your health and beauty issues. Today I've got two of the UK's leading experts around two different areas. I've got Dr. Jag Chana and Dr. Rika Taylor. Thank you very much for coming in. I'm going to start with you, Rika. Now, obviously in the guide you have written an article about fat freezing, which sounds pretty amazing. So can you just tell us a little bit about what this technology is?
Okay. The technology, this particular technology is called cool sculpting. It's quite an unusual technology, originally developed by Harvard scientists when they noticed that children who were sucking a lot of ice lollies, they noticed that they were developing fat loss in their cheeks, so they were developing dimples, and they then harnessed this idea and developed this machine. So basically the machine is very good for treating people who are within 2 stones of their ideal weight and have got pockets of pinchable soft fat. And the machine has an applicator which sucks up pockets of fat and puts the fat is then between 2 cooling plates, and the fat cells get frozen.
So it's not a weight loss treatment at all?
It's not a weight loss treatment.
No, so it's really just targeting those fatty deposits.
Yes.
We did have a question on social media from Tim, and he was saying that can this treatment be used for a man? Is it possible?
Yes, it's suitable for men and women and all races.
Great. It's just a bit more painful for men usually. It's would you agree, Mr. Chana?
Well, often the pain threshold can vary slightly between male and female patient. One often finds that men are just a little bit more sensitive.
Yes, I know. I'm a wimp myself. What, in terms of how many sessions would someone need to come in?
You can have as little as 1 session, and 1 session would give a 25 to 40% improvement of the area. But obviously, if you want more of an improvement, you can stack treatments, so you can have more treatments in the same area.
Because that's quite amazing. Because I've seen, in terms of a lot of other sort of treatments like radio frequency and ultrasound, you need to have quite a number of series of treatments, and it does get quite expensive, I think, for people that are wanting, to think about having cosmetic treatments. So this sounds like a good option. I've got another question from Jane Smith from Leeds, and she says, how many treatments would I need to have to see results if I was sort of targeting areas around the thigh area?
Even 1 treatment.
Even
1 treatment. But if you want a more wow result, then you could have more than 1 treatment in the same area.
I mean, I think in terms of the Ultimate Beauty Guide, I think one of the things we were trying to get across is having experts like yourself that are doing safe treatments. I think consumers are really worried about that.
The safety thing is really important, because obviously if there isn't a safety mechanism to monitor skin temperature, then it can cause damage to the skin. And this particular machine has a mechanism on it to detect the temperature of the skin. It's called freeze detect.
Okay. Oh, fantastic. Wow. It sounds amazing. I'll have to try it at some point.
Please come.
Yeah, no, I will. So over to you, Mr. Chana. You're obviously doing something different. You're a plastic reconstructive and cosmetic surgeon.
That's correct.
And in the guide, what you've covered is around facelifts.
That's correct.
About aging and about how sort of facelifts can be a fantastic solution. Can you just tell us a little bit more sort of about what you sort of focused on in the article?
Well, basically, facelift surgery encompasses a multitude of techniques, and it's really about individualising the procedure to actually suit each individual patient that comes to see you. And it's not just one operation that would suit every particular person. And if you actually read about these kinds of procedures on the internet or in the media, there are so many different types of nomenclatures and different types of procedures, and it can be really confusing. I think the most important factor is to see an experienced surgeon, and they will just address those factors that are of a concern to you as an individual, and then choose the right technique.
I mean, I always thought with a facelift procedure, it's for more targeted towards maybe women or men in their sort of late 50s and 60s. Is this true, or is there is it for younger people?
Well, facelift surgery can be addressed even from 40s onwards, and we're seeing a rapid rise in mini facelift procedures, for example. I think there's a huge generation of patients coming through now that have been very used to non-surgical treatments and are reaching the age in their 40s and 50s where they're finding that actually, you know, these non-surgical treatments aren't just providing, aren't providing the improvement that they would hope for, and so they're turning to surgery to see what's the next step in terms of their facial rejuvenation.
And do you combine sort of non-surgical treatments with a surgical treatment? So if someone has lost volume in the cheeks, does a facelift correct that, or is that just tightening the skin?
Well, it's interesting you say that, because modern thinking about facial aging does encompass a number of factors. It's not just the skin and soft tissues that become lax with age. If you actually think about the aged face, there's quite a lot of loss of volume. So modern facelift surgery will involve restoring that volume. And we don't often use so much in terms of non-surgical techniques, but I tend to use fat transfer in combination with facelift surgery.
So using someone's own fat?
Someone's own fat, yeah,
okay.
Absolutely.
I always like the theory behind that. You take fat from an area you don't want it, and then you can re-inject it back into places you need it. So I've got two questions here. One is from Melanie Irish from York. She says, are there any certificates or diplomas that my doctor, that I should, when I'm considering and having a procedure, is there any qualifications that specifically I should be looking for?
Well, of course. I mean, I think you should be seeing a fully qualified plastic surgeon, and most surgeons who are fully qualified will have the FRCS Plast degree and those letters after their name. But moreover, I think they should belong to the British Association of Aesthetic Plastic Surgeons. It's a body of surgeons in the UK, and it's the only body, in fact, that audits the safety figures of all their surgeons. So every year these figures are compiled by the association, and I think that gives the public some level of security in terms of the fact that they're seeing somebody from a credible association.
Just one last question was, and this is something that I've always been intrigued with, is the wind tunnel effect. And Alice is worried that, she said, I'm interested in having the procedure done, but am I going to have that wind tunnel effect?
Well, I get asked this all the time.
I'm sure.
All the time. And I think I often say that, if a facelift procedure is carried out incorrectly, or the vectors of pull are incorrect, then you can end up having that kind of appearance. And of course, a patient who looks like they've had a facelift is someone who often is not that attractive, because the facelift hasn't been carried out appropriately. And of course, the kind of results we're looking for is to achieve a result where a patient looks like they haven't had a facelift. It looks very natural.
Thank you so much for both of you coming in. If you want to find out more information about both specialists, pick up a copy of the Ultimate Beauty Guide and you can read their articles. Also, you can go onto myfacemybody.com and download your free copy there.